Is the screen slide visible now?
Yes, ma'am.
Okay, let's start with esophagus. Last time in the last class, you must have studied about pharynx, and it measures about 25 centimeter in length, approximately 10 inch in length, which is continuous above with the laryngopharynx, and its extent is it begin right from the sixth cervical vertebra or lower border of cricoid cartilage to the 10th thoracic vertebra, where it pierces the diaphragm, and it has so esophagus here, which begins from the or which begins at the sixth cervical vertebra and extend up to 11 thoracic vertebra. Okay, by piercing the diaphragm at the level of 10 thoracic vertebra. If you are asked about the extent of esophagus, it is right from the sixth cervical vertebra to 11 thoracic vertebra. But remember, at the level of 10 thoracic vertebra, it pierces the diaphragm to pass through the thorax into the abdomen. Okay, so this is about the extent of esophagus, which is continuous above with the laryngopharynx, and below it continues down with the cardiac end of stomach. This esophagus, which we have discussed, of measuring about 25 centimeter in length, is divided into three regions or three parts depending on its location. Okay, so the beginning part of the esophagus, which lies within the neck region or which lies at the root of the neck, is the cervical part of the esophagus, and the part which passes through the mediastinum is the thoracic part of the esophagus, and a small portion which measures just about 1.25 centimeter in length after piercing the diaphragm is the abdominal part of esophagus, which lies within the abdomen. Okay, so depending on the part which is present or depending on the location of the esophagus, it is divided into cervical part, which is the part present in the neck region, thoracic part which is present within the mediastinum, and abdominal part which is present within the abdominal cavity. Okay, so measurement is shown here: 4 centimeter, 20 centimeter, and 1.25 centimeter. So roughly in total 25 centimeter in length. This is about the division of esophagus. Then we'll go for the individual part of esophagus and its relation. The cervical part of esophagus is a small portion which measures about 4 centimeter in length, and it commences in the midline of the neck. Beginning of esophagus is present at midline of the neck. Okay, and as it descends down, it slightly deviates to the left side of the body. So cervical part of esophagus lies within the neck region. And what are the different structures related within the cervical part of esophagus is, let's see here in this diagram. This is the transverse section through the neck. Okay, transverse section through the neck. Here we can see this trachea. Is the diagram clear to you all? This is trachea. Okay, behind the trachea, this is the muscular tube, esophagus. So esophagus is related anteriorly with the trachea, and here on either side these are the recurrent laryngeal nerves. Okay, so right and left recurrent laryngeal nerve, and trachea is the anterior relation of esophagus. Posteriorly, it is related with the prevertebral layer of cervical fascia. It is actually the extension of the cervical fascia. Cervical fascia, which is the fascia present around the neck. Okay, so one of the layer is prevertebral layer, which lies in front of the vertebral column. Posteriorly, it is related with the prevertebral layer of cervical fascia as well as the vertebral column. Okay, this is the posterior relation: prevertebral layer of cervical fascia, vertebral column, and the pre and paravertebral muscles, which include longus capitis, longus colli muscles, are also present on the posterior aspect. Okay, while laterally, esophagus is related with, here this is the transverse section of thyroid gland, one of the endocrine gland, thyroid gland here. Okay, so on either side of esophagus, two lobes of thyroid gland are present beside this carotid sheath, which includes the common carotid artery, internal jugular vein, and vagus nerve. These are the structure related on the lateral aspect of esophagus. Okay, so talking about the relation of cervical part of esophagus, anteriorly it is related with the trachea and recurrent laryngeal nerve on right and left side. Posteriorly, it is related with the prevertebral layer of cervical fascia and vertebral column itself, including its muscle. Then on lateral aspect, esophagus is related with lobes of thyroid gland and the carotid sheath, which encloses common carotid artery, internal jugular vein, and vagus nerve. So this is about the relation of cervical part of esophagus. Then We'll go for the thoracic part of esophagus. So this thoracic part of here, this is the cervical part, which we have already covered about its extension and relation. Then we'll go for the thoracic part of the esophagus, which is present within the mediastinum. Can anyone explain what is mediastinum? Define mediastinum. One of you, you can turn on your. Why you are
It is
laughing?
space in between lungs.
Sorry.
Space in between two lungs.
Space between two lungs, or it is septum actually between two lungs, let's say. Okay, so mediastinum we already have studied is divided into, what is the subdivision of mediastinum?
Superior, medial, and
Superior
inferior.
mediastinum and inferior mediastinum. Inferior mediastinum is further divided into inferior mediastinum,
Anterior, middle, and posterior.
anterior, middle, and posterior. So only one of you is speaking, isn't it? The rest of you also try to participate. Mediastinum is divided into superior mediastinum and inferior mediastinum. Inferior mediastinum is further divided into anterior, middle, and posterior mediastinum. Now tell me, among this division, esophagus is the content of which mediastinum?
Posterior.
Posterior mediastinum within the inferior, and then superior mediastinum. Okay, so this thoracic part of esophagus passes through the superior and posterior mediastinum, then it pierces the diaphragm to become the abdominal part of esophagus. Okay, so this is about the thoracic part of esophagus and its location. Then talking about the relation of thoracic part of esophagus. Here, this is esophagus. In this diagram, let's get oriented first. Here in this diagram, this is esophagus, muscular tube, and here this is the vertebral column. This is sternum, manubrium sterni, and body of sternum, ribs. Okay, so this is the anterior aspect, and this is posterior aspect of the body. So anterior relation of esophagus is right from above downward. It is trachea. Okay, along with trachea, on either side of trachea, actually this recurrent laryngeal nerve runs between the tracheo-esophageal group, between trachea and esophagus. Okay, so right and left recurrent laryngeal nerve. Then here below, left principal bronchus. Okay, as we have mentioned, initially esophagus begins at the midline of the neck, and as it descends downward, it slightly moves to the left side of the body. So then after, firstly it is related anteriorly with the trachea, then there comes the recurrent laryngeal nerve, and then left principal bronchus, and finally the pericardium of the heart. Okay, so these are the anterior relation of the thoracic part of esophagus. Posterior relation of thoracic part is obviously the vertebrae are there, vertebral column, thoracic vertebra. Okay, then along with thoracic vertebra, on the anterior aspect of thoracic vertebra, there is the presence of thoracic duct, a zygous vein, a right posterior intercostal arteries, and then descending thoracic aorta. Here we can see this structure, descending thoracic aorta and vertebral column. Besides this thoracic duct, a zygous vein, right posterior intercostal artery are present within this thoracic cage. Okay, so these are the structure related on the posterior aspect of thoracic part of esophagus. So anterior relation and then posterior relation. Then talking about the right and left relation, on both sides, both right and left side, it is related with mediastinal pleura because it is passing through the mediastinum. Okay, on either side, lungs are there, which is covered by mediastinal pleura. So both on the right and left side of esophagus is related with mediastinal pleura. Okay. Besides, the right part of the esophagus is related with terminal part of azygous vein, which is shown here. See here, this is the terminal part of azygous vein, which drains into arch of azygous vein, and its terminal part draining into the superior vena cava. So this terminal part of azygous vein is related with the right side of the esophagus, and then left subclavian artery. Here, this is esophagus. So left subclavian artery and arch of aorta as well as thoracic duct are the structure related on the left side of the thoracic part of esophagus. Okay, are you clear about this relation? You go through this diagram. Okay, you go through this diagram. Sorry. You go through this diagram present within their textbook. Okay, and then try to remember the structure related within its anterior, posterior, right, and left side. Clear? So then we'll proceed forward. Then finally, the third part of esophagus is abdominal part of esophagus. Abdominal part of esophagus is the shortest part of esophagus, okay, which begins at the level of 10 thoracic vertebra where it pierces the diaphragm. Do you remember the three major opening of diaphragm? What are the three major opening of diaphragm? What are the
Aortic
three
opening,
major openings? Sorry?
vena cava,
Vena caval opening, then
Esophagus.
esophageal opening, then
Esophageal.
esophageal, vena
Descending
cava,
aortic,
aortic opening. So,
Aortic opening.
okay, aortic opening. Do you remember the vertebral level then of each of these three major openings?
8, 10, 12.
8, 10, and 12. Esophageal opening is at the level of 10 thoracic vertebra. So we can say abdominal part of esophagus extend from 10 thoracic vertebra where it pierces the diaphragm to 11 thoracic vertebra where it becomes continuous with the cardiac end of the stomach. Okay, so this is very short from 10 thoracic vertebra to 11 thoracic vertebra, measuring about 1.25 centimeter in length. So right and left vagus nerve lies on its anterior and posterior aspect of abdominal esophagus. Okay, right and left vagus nerve lies on anterior posterior aspect of this abdominal part of esophagus, and this vagus nerve later on become the right and left vagal trunk. So this is about the extent and location. Then relation of the abdominal part of esophagus. Now we can see this short portion of esophagus is the abdominal part of esophagus, which immediately become continuous with this cardiac end of the stomach, and here this is stomach which continues down as the duodenum. Okay, so this short portion about 1.25 centimeter length, this part is the abdominal part of esophagus, which is related anteriorly with what is this green color structure, green level structure here. This is liver. Okay, so it is related with the left lobe anteriorly. This abdominal part of esophagus is related with left lobe of liver, and posteriorly it is related with the left cross of the diaphragm. Here, right and left cross of the diaphragm. So here, this left cross of the diaphragm is posterior relation of abdominal part of esophagus. Okay. Then esophageal sphincter. Esophagus consists of two sphincter at the beginning and at its terminus. Okay, at the beginning is known as upper esophageal sphincter or pharyngoesophageal sphincter. Okay, where the pharynx terminate and esophagus begins, that is the pharyngoesophageal sphincter known as upper esophageal sphincter, and actually it is formed by the cricopharyngeus muscle. Okay, so upper esophageal sphincter is the complete anatomical sphincter having formed by this cricopharyngeus muscle, while lower esophageal sphincter is also known as gastroesophageal sphincter, as it continues down with the stomach. So gastroesophageal sphincter or lower esophageal sphincter, actually it is considered as a physiological sphincter because no any particular muscles is forming this sphincter. It is simply formed by the thickening of these circular muscles of the esophagus itself. Okay, so it simply acts as a physiological sphincter and prevent this regurgitation of gastric content back to the esophagus. Lower esophageal sphincter and upper esophageal sphincter are the two sphincter present within the esophagus, and in most of the time, except at the time of passage of food, it remains closed. Okay, so lower esophageal sphincter remain closed to prevent gastric regurgitation of the fluid or reflux of the gastric fluid, while upper esophageal sphincter remain closed to prevent ingestions of the air. Okay, so this is about the sphincter of the esophagus. When talking about the blood supply of esophagus, this esophagus is supplied by, or three different parts of esophagus are supplied by three different arteries. Firstly, the cervical part of esophagus, as it is present within the neck region, it is supplied by esophageal branches of inferior thyroid artery. Okay, esophageal branches of inferior thyroid artery, which in turn is a branch of the subclavian artery. So simply remember here, esophageal branches of inferior thyroid artery supplies the cervical part of the esophagus. Then thoracic part of the esophagus are supplied mainly by esophageal branches directly from the descending aorta or abdominal aorta. I mean descending thoracic aorta. Okay, so thoracic part of the esophagus is supplied directly, mostly directly from the descending thoracic aorta, directly esophageal branches of descending thoracic aorta, while it is assisted by superior, esophageal branches of bronchial arteries as well. But mainly, it is supplied by esophageal branches of aorta, descending thoracic aorta. And then finally, the abdominal part of esophagus is supplied by branches of left gastric artery. Okay, these supplied by branches of left gastric artery. And then venous drainage of esophagus is corresponding arteries, or the arteries are accompanied by corresponding vein, and it drains into the vein of same name. Here the cervical part of the esophagus is drained by inferior thyroid vein. Okay, inferior thyroid vein, which later on drains into the brachiocephalic vein. Then after, the thoracic part of the esophagus are drained by tributaries of this azygos, esophageal tributaries of this azygos and hemiazygos vein, later on which drains into this superior vena cava. While the abdominal part of esophagus are drained by tributaries of this left gastric vein, which are the tributaries of portal vein. Okay, so left gastric vein, tributaries of left gastric vein, and then finally drains into the portal vein, while some part of it is drained back to the azygos vein. Here, this lower part of esophagus, venous drainage of lower part of esophagus has clinical significance, as this is the site of portocaval anastomosis. See here, some of the vein which are the tributaries of azygos vein, which drains into the vena cava, superior vena cava. And some of the tributaries here, tributaries of left gastric vein, drains into the portal vein. So portal and systemic veins are anastomosing within this lower part or abdominal part of esophagus. Okay, so this is one of the site of portocaval anastomosis or portosystemic anastomosis. Are you listening? Are you getting my points? Are you there?
Yes, ma'am.
I hope you are clear. Do I need to repeat the blood supply? Simply, cervical part is supplied by, the arterial supply of cervical part of esophagus is from the esophageal branches of inferior thyroid artery. Thoracic part is from the esophageal branches of descending thoracic aorta, and abdominal part is from the esophageal branches of left gastric artery. Remember this, okay? Then, talking about the venous drainage, cervical part drains into the inferior thyroid vein. Thoracic part drains into the tributaries of azygos and hemiazygos vein, okay, while abdominal part drains into left gastric vein and then into portal vein, while some portion drains back into azygos vein here. So this azygos vein draining into vena cava, this is the systemic vein here, and then portal vein, left gastric vein drains into portal vein. So here, this is the site of portocaval anastomosis, where the systemic vein here are anastomosing with the portal vein. Okay, so this is the site of this is one of the site of portocaval anastomosis, which has clinical significance, which will come later on in this clinical note. Okay, so I hope all of you are clear now. This is just for your convenience here. Tabulated form of arterial supply. Upper one third, that is cervical part, is inferior thyroid artery, branches from descending thoracic aorta, thoracic part, and abdominal part, left gastric artery. While venous drainage is inferior thyroid vein, azygos and hemiazygos vein, and then left gastric artery, which is a tributary of portal vein. Okay. Along with this blood supply, the lymphatic drainage is the upper cervical part drains into deep cervical lymph node, as it is within the neck. So deep cervical lymph node is the lymphatic drainage of cervical part. Superior and posterior mediastinal lymph node is the lymphatic drainage of thoracic part, and along left gastric blood vessels to the celiac node is the final site of lymphatic drainage of the abdominal part of esophagus. Okay, so remember, deep cervical lymph node, cervical part, superior and posterior mediastinal lymph node, thoracic part, and left gastric via this left gastric vessels to the celiac node from this abdominal part. So this is about the blood supply and lymphatic drainage of esophagus. Then we'll go for the nerve supply of esophagus. The esophagus is supplied by esophageal plexus. Okay, esophagus is supplied by esophageal plexus, which is the plexus formed both by sympathetic and parasympathetic. So esophagus, which is the viscera, and we know all the viscera are supplied by autonomic nervous system, which includes sympathetic, parasympathetic nerve. So esophageal plexus is one of the autonomic plexus, which is formed both by sympathetic and parasympathetic nerve. Sympathetic nerve here forming the esophageal plexus is from the cervical sympathetic chain, cervical sympathetic node, and then thoracic sympathetic trunk. Okay, so from cervical and thoracic, both sympathetic are from the cervical and thoracic trunk, while parasympathetic is from the vagus nerve. So parasympathetic offering different is from the vagus nerve, and sympathetic is from the cervical and sympathetic chain, thoracic sympathetic chain. Esophageal plexus supplies the this sympathetic parasympathetic nerve to the esophagus. Okay, this is about the nerve supply of esophagus. So we'll go for the clinical note of esophagus, which include one of the important condition here known as echinacea cardia. So here what happened in this condition is, which is associated with degeneration of this esophageal plexus, mainly the parasympathetic nerve fibers. If damaged or degenerated, which is present within the wall of esophagus, there occurs neuromuscular incoordination. So what happened here is, in mainly the primary site of this echinacea cardia is the lower end of the esophagus, that is cardioesophageal junction. Okay, cardioesophageal junction where there is lower esophageal sphincter present. So what happened here is the lower esophageal sphincter fails to relax normally. While passing the food, it has to relax. Okay, but in this condition known as echinacea cardia, what happened? This lower esophageal sphincter fails to relax normally, and then the food will be accumulated within the upper part of this segment, or the constrictions of the esophagus. So there are normally four different sites of anatomical and physiological constriction. Okay, these are the normal sites of constriction. Normal sites of constriction. The first constriction is right at, so distance from upper incisor teeth is about 15 centimeter or 6 inch. So either you, then second constriction is the second constriction, which about we have studied about the anterior bronchus constriction. So just 1 inch from the upper incisor teeth. And the fourth one is when it passes through the diaphragm to enters the abdominal cavity, measuring about 15 inch from the upper incisor. So this is more from to enters the abdominal cavity. Okay, so this is about the measurement and the sites of normal sites of constriction of esophagus. This is very important from you for you from clinical point of view as well as theoretical point of view. And why we should know about this constriction, what is the clinical importance of this constriction is, the solid foreign bodies most often or most commonly lodge within these sites of constriction. Okay, so we should know these four normal sites of constriction. Then this is the site where there will be difficulty to pass through the difficulty to pass this esophagoscope, or during endoscopy this tube is, there will be difficulty to pass through this constriction site. And within this normal sites of constriction, strictures may develop after drinking excessive amount of caustic fluid. Okay, so this harsh fluid, when we drink, such individuals, they might develop strictures within this normal sites of constriction, and this normal sites of constriction may become abnormal. Okay, and this normal sites of constriction is one of the common site of carcinoma, esophageal carcinoma, common sites of esophageal carcinoma. So these are the clinical importance or significance of this normal sites of constriction. So we should know about this sites of constriction. Okay, so can you recall what is the first, second, third, and fourth sites of constriction of esophagus? Anybody? Shall I need to call your name? Prajol is Prajol there? Prajol Kafle? Are you there, Prajol? Are you people listening?
Yes, ma'am.
Where's Prajol? Prajol Kafle? He's absent. Or he has already left the group.
Yes, ma'am.
You are there, no? So can you tell
Yes,
me the normal sites of constriction and what occurs those constriction? Four normal sites of constriction of esophagus. Okay, anybody? Then anybody can speak out.
The beginning
Yes,
of esophagus when When
Yes.
pharynx joins with the esophagus and behind
Let's
the
say
air,
at the beginning of the esophagus, pharyngoesophageal junction, isn't it?
and yes, and when it crosses the aortic arch and behind the left bronchus,
Mm-hmm.
and when it enters the stomach.
Not exactly when it enters the stomach, when it pierces the diaphragm. Okay, when it pierces the diaphragm. And what about the measurement? Do you remember the measurement? It is 6 inch, 9 inch, 11 and 15 inch. 6, 9, 11 and 15 inch from the upper integer teeth. Okay, so these are about the. Then another important aspect of this esophagus, which we already have discussed, low one third of esophagus. What is the venous drainage of low one third of esophagus? Venous drainage of low one third of esophagus.
Left gastric vein.
Tributaries of left gastric vein. Okay, so here we have just previously discussed low one third of esophagus. Here, esophageal tributaries of azygous vein and esophageal tributaries of left gastric vein anastomose with each other in that part, okay, forming the portosystemic or portocaval anastomosis. Then what happened here? Suppose the person is very alcoholic or having some liver cirrhosis disease or portal hypertension. So in case of that, portal vein will be obstructed. Okay, if there is cirrhosis of liver and any kind of portal hypertension, portal vein cannot properly drain its blood into the liver. So there will be backflow of the blood. Instead of going into the portal vein and into the liver, there will be just opposite reversible flow or reversal of the flow of blood. Okay, so these blood vessels will be dilated. These veins will be dilated in case of portal hypertension, or let's say in case of liver cirrhosis. Then in severe condition, such bloods may the dilated vein here. Okay, these dilated vein are known as esophageal varices. Esophageal varices, and in severe condition, this dilated vein may rupture, leading to a blood vomiting known as hematemesis. Okay, so this is one of the site of portocaval anastomosis. There are many more sites of portocaval anastomosis which we'll be studying when we study about the hepatobiliary system. Okay, so remember one of the site of portocaval anastomosis is this low one third of esophagus, where the systemic vein anastomosis is tributaries of azygous vein, and the portal vein anastomosis is tributaries of left gastric vein. Okay, are you getting my point? What is this portocaval anastomosis actually? Do I need to repeat?
No, ma'am.
Are you clear, all of you? Once again here, systemic vein. This azygous vein is finally draining into vena cava, superior vena cava. Okay, so any vein which is draining into either superior or inferior vena cava is systemic vein, and any vein which is draining into the portal vein will be the portal venous system. So here the tributaries of azygous vein, which is the systemic vein as it drains into the superior vena cava, and the tributaries of left gastric vein, which is draining into portal vein, is the portal vein, and here this one is the systemic vein. So this systemic vein and portal vein are anastomosing with each other. Can you see this diagram? The diagram is clear here. Systemic vein and portal vein are anastomosing with each other, forming the portocaval or portosystemic anastomosis. Okay, so this sites of portosystemic anastomosis is important in severe clinical condition like portal. We were here, no? Are you people there?
Yes, madam, we are revising.
We have discussed about this portocaval anastomosis, no?
Yes, ma'am.
It is over.
Ma'am, you had been repeating the portocaval anastomosis.
Okay, then we'll go for the Barrett's esophagus. Is that okay? Now, I was asking you people about the lining epithelium of esophagus. Though you have not studied the histology portion of esophagus, but we already have studied epithelium in our first semester. Okay, so can you give me example of keratinized stratified squamous epithelium, keratinized stratified squamous epithelium, and non-keratinized stratified squamous epithelium? Example one of each. Do you remember?
Keratinized would be skin, non-keratinized would be esophagus,
And Okay, leave it. So esophagus lining epithelium is non-keratinized stratified squamous epithelium. Okay, isn't it? Esophagus lining epithelium is non-keratinized stratified squamous epithelium. But in case of toxic insult or the exposures, repeated exposures to this caustic rings and like that, okay, there will be change in the lining epithelium. Like this, normal lining epithelium is non-keratinized stratified squamous epithelium. Okay, so due to acidic reflux, repeated acidic reflux or gastric reflux, the non-keratinized stratified squamous epithelium may get converted to gastric epithelium, that is simple columnar epithelium. Okay, the stratified epithelium may get converted to gastric epithelium. This is reversible change in the epithelial lining, and in severe condition or in chronic condition, this buried esophagus may lead to cancer in about 10% of individual. Okay, if there is repeated like the person having repeated gastroesophageal reflux disease or like that, the lining epithelium of esophagus changes, and that type of esophagus is known as Barrett's esophagus. Clear? There is change in lining epithelium, normal lining epithelium. Okay. Then here, the diagram here is showing the barium swallow. So, actually, this hollow viscera are invisible to the plain X-ray. Okay, so what we need to do to visualize this hollow viscera is we have to either inhale or inject this radiopeptide. For gastrointestinal system, barium sulfate is what used for this contrast X-ray. Okay, so barium swallow is the procedure where barium sulfate solution is drank by the patient, and afterward the X-ray is taken where we can see the esophagus here. Okay, so any abnormality related to esophagus can be diagnosed by this barium swallow. Here in this condition, this esophageal cancer is shown here with the help of this barium swallow. So barium swallow is just to make the esophagus visualize within the X-ray, and such type of X-ray is known as contrast X-ray, and the X-ray shown here, contrast X-ray shown here is of the barium swallow to visualize the esophagus. And barium will visualize the stomach and small intestine, while barium enema visualize the large intestine in similar fashion. Okay, so this is about the X-ray of thorax. So this is all about esophagus. Any part do I need to repeat? Any confusion?